Good afternoon. Thank you, everybody. Today, we are going to talk about how leveraging cloud native technologies in healthcare to respond to the urgent needs due to COVID-19.
The cooperation with Symphony as a software supplier was one of the leading factors that led to our success, in my opinion. I'm absolutely not a technical person, and I needed a one-stop shop principle for the fulfillment of all our technical requirements. Symphony's help was able to solve this question, and with the platform, of course, the infrastructure, the hardware devices, solutions, how to manage them, it was absolutely a full package. And additionally, when we started the government projects, we were asked to kick off within a week, or actually even within a weekend. So everyone from Symphony made this possible, and we were able to do that because of Symphony.
When you demo something to your potential investors, it's one story when you demo just PowerPoint slides, and another story when you demo a working solution. Another challenge is that when you have to build something very quickly, you need to find a way how you can actually borrow potentially some code from third-party solution or open source, or from look how you can develop it yourself, and building something in a couple of weeks, creating a team in a couple of weeks from scratch and deliver a solution. It's quite a big challenge to take on. Very fast we faced another challenge where we had to react and adapt to the changes coming pretty much every day or several times a day. Another important one is security and privacy of European citizens, and their healthcare data is subject for strict regulation, and we need to make sure that the system we are designing is secure and will satisfy privacy requirements as well from the very beginning, and no components of the system will leak data outside, and we will keep it locked. As I've told, we have used the function as a service approach, and we have utilized as much of serverless technologies from AWS as possible, and we end up completely serverless, so we don't have any servers to manage. We have used, for the engine of our backend API was built using API Gateway, AWS Lambda, and DynamoDB technologies, where we have used simple storage service from Amazon to properly deal with the files in a secure and encrypted way. We have used CloudFront for our public websites to make sure that our websites is highly available on any device in any country, and that we will sustain any hacking attempts or denial of service attacks. Also, for user authentication, we have used Amazon Cognito service, and services like simple email service and simple notification service for secure and easy integration to deliver emails and SMS messages to our clients, of Spoedtestcorona, actually end users as well. And another important thing, that from the beginning we were following infrastructure as code approach, so we were automating our infrastructure rollout from the very beginning and integrating it with CI/CD pipelines, and that gives us ability to roll out new environment, to host another tenant, or to work with a new business, quickly adding B2C capability or B2G capability into the system in matter of hours, instead of making requests and waiting for days to prepare the infrastructure. Most important for us, in order to make it happening, one of the key takeaways is that you have to focus on business first, not to how to build an infrastructure, how to scale the system if there will be a significant number of users coming, but rather think about the business first, how business would be scaling, how they will find more doctors, which are in the high demand on the market, and how to bring a solutions that would allow to minimize that for them as well, because that was much more important to scale rather than having ability to serve more users simultaneously on a web server. Putting infrastructure, security, maintenance on the shoulders of the cloud provider allows you to deliver a solution with a smaller team, with less resources needed, and less communication overhead, and you can just go faster. Thank you all.
I think that was it. We hope to see you soon in the future on our next webinar.